Hi everyone, I'm Kaylee. I'm one of the dietitians here at St. Joe's. Thank you so much for tuning in tonight. We're going to be talking about fall flavors and how that incorporates to the American Institute for Cancer Research's New American Plate Method. So as you can see over here, this is what the AICR calls the New American Plate Method. And so I'm briefly just going to talk about the protein section, and then we're going to dive into the meat of this. So ideally, 1/3 of your plate should be protein-rich foods. So think turkey, chicken, seafood, dairy, eggs. Those are all really good sources of lean protein that promote satiety and weight maintenance. However, 2/3 of your plate should be plant-based foods. The AICR does really emphasize more of a plant-based diet, so I want you to think fruits, vegetables, whole grains, beans, nuts, seeds, and legumes. The more color and the more texture you have on your plate, the better. I always say no one got sick eating too many fruits and vegetables. So again, the more color, the more texture on your plate, the better. And the reason why is because different fruits and vegetables, depending on the color that they have different vitamins, minerals, antioxidants, and phytonutrients. So by getting a variety of these colors on your plate, you're ensuring that you're getting adequate vitamins and minerals. Now, I know some people are not big vegetable or fruit people, and that's okay. One thing that you might want to do is try different low-fat cooking techniques. I know some people think you have to have a salad every single day, and that's not the case. Vegetables tend to be sweeter when you cook them, so you might want to try sauteing, roasting, steaming, grilling. All of these are low-fat cooking techniques that are going to enhance the sweetness of vegetables, which I know sounds a little bit weird, but it just makes it more palatable for you. Also, don't be afraid to add different seasonings, sauces, condiments. Garlic and onion go a long way, and a small study has actually shown that by cooking with garlic and onions, it may reduce your risk of breast cancer. So again, use the seasonings. You can do garlic, onion, cilantro, basil, red pepper flakes, paprika. All of these are going to add flavors, so you don't have to think that fruits and vegetables are automatically boring. So again, the more color, the more texture, and don't be afraid to experiment with different cooking techniques and flavors. Now we're going to move on to the benefits of eating in season and what seasonal eating looks like, specifically what fall flavors are. So one of the biggest reasons I advocate for eating in season is because it's more affordable. You can stick to a budget and you don't always have to eat just canned vegetables. You'll notice that fall produce tends to be a little bit cheaper at the market. But you also might be wondering, well, how do I know what's in season? And so one great way to find out is to actually shop at the farmers markets. Not only are you supporting a local economy, but you're also going to find out what's actually in season because it's what the farmers are growing. You also get to know the farmer, and then you also see and hear how the produce is grown, which I think is really interesting. Also, by shopping at the farmers market, your produce doesn't have to travel as far, so it retains more nutrition. So again, shopping at the farmers market is a great way to save some money while eating seasonally and also supporting the local economy. So now let's dive into what fall nutrition looks like. And I know a lot of people assume that summer or even spring has more produce and it's easier to eat fruits and vegetables. So a lot of people don't realize that fall produce packs in a lot of nutrition. So when you think fall, I know most people think pumpkin or winter squashes, which is true. That's a really great source of vitamin C, and vitamin C is a very potent antioxidant. It protects our cells from DNA damage from the toxins in the environment and from what we eat. So again, this is my permission to eat pumpkin, acorn, squash. Those are all really great sources of vitamin C. But also the cruciferous vegetables are in their prime right now. And so when you think cruciferous vegetables, I want you to load up on Brussels sprouts, broccoli, kale, cauliflower. This group of vegetables has been shown to decrease the risk of breast cancer, gastric cancer, and colorectal cancer. And at the end of this presentation, I do have a recipe for you that involves Brussels sprouts because I know that vegetable can be hit or miss. Also, apples. You can't forget about apples. There's over 2,500 varieties of apples, so there's a flavor for everyone out there. And again, at the end of this, I do have a recipe for a healthy baked apple dessert because what is life without a little bit of dessert? which ties into my next point of fall is also a time where baked goods become a little bit more prevalent, especially compared to spring and summer. And so while pumpkin and apple are high in fiber and they have a lot of vitamins and minerals to them, when put into a baked good, they also have a lot of added sugar. And so while there's still a lot that we don't know about diet and nutrition, what we do know is that maintaining a healthy body weight, ideally a BMI of 18.5 to 24.9, greatly reduces your risk of cancer, cancer recurrence, or a secondary cancer. And so the reason I bring this up now is because sugar, especially in the forms of baked goods, is really easy to overeat. Our bodies like sweetness. We like it because it provides us with fuel to do our day-to-day activities. But added sugar doesn't have a lot of nutrition to it, doesn't have a lot of vitamins or minerals. And again, it's just really easy to overeat, which over time, if you overeat too much on a day-to-day basis, that can lead to weight gain, which we don't want because, again, we want to maintain that healthy body weight. So I always say everything in moderation, but you might be asking, okay, you're telling me not to eat too much added sugar, but what does that actually look like? So the American Heart Association recommends that no more than 100 calories comes from added sugar, or about 25 grams. And for men, it's 150 calories or 36 grams of added sugar. And so I don't know if you've noticed, but the Nutrition Facts label had a revamp a couple years ago. And so now most food products have a line for added sugar. So before it used to say just total sugar. So you didn't know what was coming from fruit, grains, or naturally occurring sugar in milk. But now there's a section below it that says added sugar. And so that's where it's going to be really important to see how many grams of added sugar is in your food. And again, for women, no more than 25 grams a day, and for men, it's 36 grams a day. That being said, though, moderation is key. Just maybe save your fall dessert for a very special occasion or something you truly enjoy. Overall, fall is a really great way to load up on your fiber-rich foods that are high in vitamins, minerals, antioxidants, and phytonutrients. But don't be afraid to indulge every once in a while on your favorite fall good. And so now I just want to post a few recipes that I think you guys might find helpful. One is going to be the maple roasted Brussels sprouts. So this is a great way to get those cruciferous vegetables in, but by baking it, it's also going to add sweetness. So hopefully it's a little bit more palatable for you and your family, as well as mashed cauliflower, which is a great side dish to any meal that you're doing this fall, and then as well as a healthy dessert, which is just a baked apple topped with some granola. So again, thank you all so much for tuning in tonight. I really appreciate it, and I hope you learned something from this lecture. And I also wanted to provide a list of just other resources for you to look up if you have some time or you want to look up more about diet and nutrition. So again, thank you so much. It was my pleasure.
Welcome to Medicare Made Simple. My name is Raul Morales. I have a little agency here in Orange. The name of our company is Raul Morales Insurance Services, Inc. We're a local agency servicing the Medicare population for the last 20 years. In fact, we actually had a hand in starting the Medicare education program at St. Joseph's Hospital about 17 years ago. The first part about our program is what we're going to do. We're going to be talking about Medicare. St. Joseph's, or Providence St. Joseph's now, calls it Medicare Made Simple. And the first thing we're going to do is talk about what we do as a company. Well, we specialize in education. We're a local broker. You don't have to call an 800 number to get anybody that you'll never see again. And we service our 1,200 clients on a yearly, daily, monthly basis. Some of the updates we're going to give you are going to include Medicare updates. The newest one is addressing the Medicare Advantage plans at Providence St. Joseph's. And basically, the Providence St. Joseph's system is actually Providence Mission Hospital, St. Joseph's Hospital, and St. Jude's Hospital. One of the newest things we'll talk about is the newest plan they've had. We'll go over all of them in a few minutes. But the newest plan that they have is called Clever Care. Nobody's heard of it. It's so brand new that the kits aren't even out in the public yet. The doctors don't know about it. So if there's scuttlebutt or questions, we want definitely you want us to you want to call us so we can explain what Clever Care is. The other thing we'll talk about initially that's news, it's been going on for about 5 or 6 months, is Medicare came up with a senior saver plan, which addresses medication only. It's saving folks that have insulin dependency and using insulin. They're saving them money from contracting with plans that are participating. And what that means is not all plans that are in the Medicare business are participating in this program. It's a 5-year pilot, but it's great because it offers insulin to those folks who seek lower prices. For the first time that I know of, insulin now is capped at $35 with a participating company, and at least one company in our neighborhood here in Orange County has insulin down to zero costs per month with selected insulins. The program will be talked about extensively in another session, but today is education, the Medicare basics, or again, Medicare made simple. The other plans we contract with, and we'll talk about that I mentioned, Blue Shield of California, United Health Plan, SCAN, Anthem, Blue Cross, HealthNet, and of course Clever Care, the newest kid on the block. We provide a PowerPoint. I'm going to go off the PowerPoint on this YouTube presentation. I'm going to go over all the PowerPoint slides and elaborate as needed. The Providence Mission Hospital, St. Joseph's Hospital, St. Jude's Hospital logo is new. So that's what's going on now with the company. They offered 3 hospitals. Actually, there are 4 because Mission in Mission Viejo, Mission Hospital has an affiliate or a sister hospital in Laguna Beach. But the center of the county is St. Joseph's Hospital, and in the north would be St. Jude's Hospital. The program features one extraordinary team of doctors, ancillary units, and a way to deliver healthcare system. And I'm going to elaborate by saying that these 4 hospitals are integrated to offer the public who uses our system by these 4 hospitals, but they also include 6 different medical groups and over 1,000 doctors. The medical groups by name, in Mission, at the Mission Heritage Medical Center, it's called Mission Medical Group, and then in that group is another group called Mission Hospital Affiliated Physicians, which is an IPA, and then St. Joseph's Heritage Medical Group at St. Joseph's Hospital, and then there's St. Joseph's Hospital Affiliated Physicians. That's the 4th group. And of course, the 3rd group is, or the 5th and 6th group is out of St. Jude's. St. Jude's Heritage Physicians is the group name up there. And then St. Jude's Affiliated Physicians is the IPA. Over 1,000 physicians, many are specialists, and they're spread out throughout the county. It's integrated, so that means if you are in managed care and you choose one of these groups and you choose one of the contracted health plans, you can have a specialist in another hospital. You could be a patient and with primary care in St. Jude's and use St. Joseph's Hospital. It's often done, it's integrated, and all it takes is a referral. Another way to talk about doctors is a system that we've devised and how to find a doctor when someone is looking to see who participates. There is a brochure. It's printed every year, and it's a list of doctors. And to get one, you'd have to call us, and we can mail one out. Another way is do it online. Find a doctor. You have to have an account, and you can access the account and access all the doctors, especially the primary care physicians, online. You can find out about them, about their biography, their history, and their viewpoints. Another way to access care through managed care would be accessing care through your doctor, obviously. He'd be the primary care physician orchestrating your health care. There are urgent care centers throughout the county as well, and they are also integrated and part of the plan. Then you have the nurse advice line that's for free off a 1-800 number. So it's a very sophisticated way to access care. All you have to do is learn a little bit about it. A little bit about us, how to contact an agent like myself who is doing education programs for the public, individuals, and couples. You can call us. Our info will be posted on this program. So I'm not going to bore you with where our address is and our phone numbers, but it'll be posted. You get a hold of us rather easily. Now we're going to switch gears a little bit and talk about Medicare and what Medicare is. The first thing we talk about under Medicare is who is eligible and how do you become eligible and how do you get your Medicare. The eligibility slide that I'm looking at here, it requires a few things. One, you must be a U.S. citizen or a permanent resident and who has lived in the U.S. for at least 5 years. There's more. If you or your spouse paid into Social Security for over 40 quarters or 10 years, that's the biggest demographic. 40 quarters or 10 years. And the Social Security office is tracking those numbers for you and find out if you've had those numbers met by the age 65. All you got to do is call the Social Security office and start the enrollment process. That's one way. The other way is go on www.socialsecurity.gov and you can get on your application process that way as well. If you have not paid into the system those 40 quarters or 10 years, but you were married to someone who actually had the 40 quarters or 10 years, you may be eligible through the spousal rule. Another way to get on Medicare and qualify through eligibility would be persons under 65 years old with certain disabilities. The old standbys were Lou Gehrig's disease, Kohl-Leinner's disease. There are many, many qualifying debilitating diseases that will qualify someone. Usually it takes 24 months to qualify. Contact the Social Security office if you think you are in the running. There are a few exceptions where the 24 months could be waived. One of them is end-stage renal disease. Now we get into the basics of Medicare. The rudimentary slide about what is Medicare, what are the parts? There are 4 parts. We're going to talk about Part A, the first part of Medicare. Part A doesn't need any premium to qualify. You need the 40 quarters of 10 years, and usually you will qualify to get Medicare Part A automatically. So what is Part A? Part A is hospital insurance. When you're admitted, you're working your program under Part A. You have to be admitted for Medicare Part A to kick in. Part A by itself, or original Medicare, carries a $1,408 deductible. So if you're admitted and you have no extra insurance or Medigap policy or Medicare Advantage plan, you're going to be faced with a $1,408 deductible by just walking in the door. And then if you're there for a long period of time, it gets very stiff after that. Now we're talking about Medicare Part B. So Medicare Part B is everything under Medicare that's out of the hospital, which would be outpatient, providers, specialists, visits, outpatient care, durable medical equipment, therapy. All those things that happen to folks under Medicare outside the hospital are running under Medicare Part B. B also has a premium. That one is not free. Even if you have the 40 quarters or 10 years, your basic minimum premium is right now at $144.60. It can go up from there if you happen to have income more than the scale that I'm looking at. So basically right now, if you're a single person applying for Medicare and your $87,000 income in the last 2 years, the Social Security office will report to Medicare about what they should charge you. If you're under $87,000, single taxpayer, you're going to get hit with $144.60 for a Medicare Part B premium. However, if you're 2 people on a tax return, that figure goes to $174,000 or less, and you pay the $144.60 as well. That would be each. Now let's say you're over 87,000 single payer. The first surcharge goes to $58 over the 144.60, which brings it to $202.40. And there are 4 more layers of surcharges for people that have higher and higher and higher income. So we say congratulations to those folks, but you will get charged, and as income comes down, you can negotiate with the Social Security office to bring the premium down according to scale. Now we're talking about what Medicare does not cover. So just original Medicare, we make the argument that you can qualify for Medicare A and B, and now you have it. But you got to do more with it, or at least understand what would happen if you do not take on a Medicare Advantage plan or get into a Medicare Advantage plan or a Medigap policy. So if you leave your bare bones Medicare alone, you face those deductibles I just mentioned, and you also have coinsurance. So original Medicare in outpatient systems will charge you 80%. No, Medicare will pay 80%. You get charged the 20% on the other side. So let's say you go to the doctor and the doctor charges $150. He'll look up and Medicare allows him to charge Medicare 80%, and Medicare will pay it if the billing does correctly. And then you, the individual that does not have extra insurance or a Medigap or a Medicare Part C plan, which is called an HMO, you'll get hit with the other 20%. Well, it's okay on that doctor's office scenario. However, if you end up in chemotherapy or you end up in a lot of therapy and using a lot of outpatient procedures like MRIs, you've got to come up with 20%. So it could get very, very expensive. So we always tell people, be aware of the 80-20 rule if you don't do anything with your Medicare. That's why educating yourself about what your options are, that's what this program is going to do. The other things that Medicare does not do, Medicare itself does not do prescription drug coverage. They contract with plans that you can sign up for. Once you have your Medicare A and or B, you can get prescription drugs, but you have to go out of your way to sign up for these plans, understand them, solicit them, look for them, compare them, and then sign up, and then you would be getting prescription drug coverage. The other part of original Medicare, what it doesn't cover, are the extras. You hear a lot about the extras on the television set, on a lot of advertising coming in the mail, the extras. They're called extra benefits. They're non-medical items, and I'll name a few: hearing aids, exams and screenings, dental programs, eyewear allowance, healthcare outside the U.S., and then you have a host of other things that would take a half an hour to list because they're new, and those are things that are called outside the realm of medical, and they're called extras. But Medicare, original Medicare, does not cover those. Okay. Now we're going to talk about more specifically, what is a Medicare Part C plan? Well, the definition of Medicare Part C, this is the third part of Medicare I'm now talking about. I'm addressing the Medicare HMO system that started in 1985 in Southern California and throughout the U.S. These plans have been doing business with Medicare, offering an HMO under Medicare. You have to have Medicare A and B to solicit a Medicare Part C plan or a Medicare Advantage plan. The old name was the Medicare HMO. They feature no or low premiums. To join these plans in Southern California, if you're living here, you're living in the right place, because just go to Ventura County and you're going to get hit with $35 to $65 a month, where in Orange County, LA County, San Bernardino, and Riverside, you do not have a premium for most plans. You get low or zero copay structures in these plans. They're very competitive here in the Southland, and you just have to shop and see what plans do better for you than others. There are no deductibles on these plans. They include the prescription drug coverage. That means if you join a Medicare Part C or Advantage plan, the prescription drug coverage is embedded or is part of the plan just by signing up. Never sign up on an Advantage plan without checking it that they cover your specific drugs. And that's what we do at the agency. When we meet somebody, we ask them, the second question we ask them is, the first one is, where do you live? The next one is, what medications are you on? So we can begin to look at what plans are going to cover those medications optimally. You must choose a primary care physician in the system. You have to have a primary care physician who orchestrates your access to the care. And that physician is responsible for getting your referrals to specialists and making sure that that doctor stays on top of everything about your health care. So you will be good friends. If you're in the system, the best friend you can have is your doctor orchestrating health care for you. Some of the extras of Medicare Advantage plans, they have listed here. So basically, it's dental plans, vision plans, hearing aid benefit, which are discount programs, chiropractic acupuncture, a free gym card or fitness program, transportation on most plans now, over-the-counter allowance, brand new with Medicare. They're asking companies to participate and offer the public who joins these plans as members over-the-counter allowance. What are those? Anything you see at the pharmacy that's not a prescription drug is probably on the over-the-counter offering on the list. Personal emergency response system is offered by most plans now. Foreign travel, when you're out of the country, most plans offer foreign travel, but they offer at different limitations. Some as low as $10,000 when you are in foreign travel. Some as high as unlimited. There's a big difference there. The virtual doctor appointment is now part of the program because of COVID. Meals on discharge through a plan. Not all plans offer this program, but if you think you might need that program someday, you better ask around and compare. And then caregiver respite care. This is when a plan decides to offer you, the client, when you need, when you're being taken care of by a loved one in your home. Respite care means you can call the company and they'll have somebody come in and take care of you for 40 hours a year, which means it's 4 hours a day for 10 days, relieving the caregiver. That's what it's designed to do. So if you're in managed care, who's coordinating your care? Well, your primary care physician is the number one person that is going to be helping you out. They're the ones who see you for everything you do, and they're the ones who write up the referral in case you need to go to a specialist, and they do your physical. So between you and the doctor, you're orchestrating your care. However, the other side of Medicare, the other options that you might get through Medicare is not all under Part C. Original Medicare allows you to go into the fee-for-service Medicare system or solicit a private plan that says they sell you a Medigap policy. Another word for that is a Medicare supplement. It's not like an HMO. It is more like a PPO. We like to call them by the right name, and we call them fee-for-service with Medicare. We call them private insurance. We call them Medigap, and we call them supplements. We do not call them PPOs. And who orchestrates your care there? You are the center of the universe with this kind of plan. You have to understand how they work, and we'll go into some detail in a minute. But those are your two options. You can pick Medicare with a Medicare Advantage plan, Part C, or you could pick Medicare and sign up for a Medigap or a supplemental insurance program that works like a PPO. A lot more leverage. You don't have a primary care doctor on your card. Your referrals you do on your own. You seek out your care, and all you got to do is tell them you're on Medicare and a supplement. And that's how that works. It's simple, but it really is that simple. Medicare supplements feature that they're designed to fill the gap between Medicare A and B and what Medicare doesn't cover. Originally, we were talking about what Medicare doesn't cover. Medigap policies cover that 20% on outpatient procedures and care. So that means if you have something going on, like an MRI, and Medicare pays 80% of a $5,000 MRI. You would normally have to pay 20% unless you have a Medigap policy. Then they get to pay the 20%. Thus, really, all you have is a premium. And we'll talk about those in a minute. Medicare is a primary payer, so you have to show your Medicare card and say, I'm on original Medicare and a supplement. And then your providers know what to do on the billing. Direct access to specialists. That means you have to call, and you call direct. You don't go through a system, a referral. You just go direct by picking up the phone. And sometimes you need a doctor to help you out with that, but basically you're going direct. This plan does not include prescription drugs. It's a la carte. You have to buy prescription drugs separately. So if you go down this road with Medicare, original Medicare, you have a premium with Medicare, as we stated earlier. You will have a premium with a Medigap policy. And right now, a 65-year-old is going into maybe Plan G. It's about $131 a month. And every year, they're going to go up 5, 6, 10% per year. They won't stay put at $131. By the time you're 70, you're going to be over $200 a month. By the time you're 75, you're at $275, $300. By the time you're 82, or they level off, you're probably at $375 or more. So these plans do not stay put. The premiums increase with every year you're on the plan. And then the prescription drug plan, I said, was not covered. Now you have to solicit one of the 62 different companies offered in Orange County, or actually in the U.S., because these are federal programs. You get to pick out of 62 different prescription drug plans, because all of them will be a little bit different. The lowest premium I've seen for 2021 is $7.20. The highest I've seen is over $200 a month. So which one will you take? You have to do the homework. We could show people how to do it. Our office is dedicated to getting people on the right plan by asking them what medications are you on and where do you live. That's all we need. You have to pay your Medicare Part B no matter what you do. If you go into Medicare and you're on A and now you're on B and now you add a plan, a Medigap, you still got to pay your Medicare Part B. So in a Medigap policy, the Part B premium is on top of the Medigap policy, and the prescription is on top of that. You'll have 3 premiums if you go down this way. On the Medicare Advantage plan, you have to pay your Medicare B, but there are no premiums on those plans. That's the first distinction we make. Now we're going to talk about prescription drugs. You can get it one of 2 ways. I mentioned earlier you could get it under Medicare Part C. Medicare Advantage plans include drug programs. And what do they give you? Well, they're going to give you $4,100 next year. I think it's $4,120. $4,120. Actually, no, it's $4,130. This year was $4,020. So it's $4,130 in your initial coverage. The minute you join a plan, you walk into the year 2021 in January, you have built into the system $4,130 worth of purchasing power. There are adjustments for people that have higher than normal income. The Social Security office will inform them through their plan that they pick that they have a surcharge, and they've got to pay that. It's not as steep as a Medicare Part B adjustment, but expect that if you have higher than normal income, it'll be coming in. You'll be notified the minute you join the plan. You must live in the service area. So if you live in Orange County, you're picking a plan that does business here in Orange County. It may help you lower your prescription drug costs. Actually, that's the definition of these plans. They were designed to give you the money so you don't have to pay the first $4,100. But it's more complicated than that. So how do you use your $4,100? Every time you go to the window at the pharmacy and you give them a card and they give you your prescriptions in a white bag and you walk away, the following month you will get a statement that shows how much money you paid for a copayment Your generics could be 0. Your generics could be as high as 10. But that's tier 1 and tier 2. Tier 3 are brand names, and they start at $25 and go all the way up to $80 to $100 on tier 3 and 4. Those are monies out of your pocket. And then they'll track every dollar that's expended from your pocket. Your statement will reflect that. But what's really going on is the $41.30 that you got built into the system, they deduct the value of the drug and the copayment that you paid with every transaction. On the 6th through the 10th of the following month, you get a statement. And remember, always read your statements for the rest of your life. They reveal a pattern of your money, how you're using it, how fast you're using it. A lot of folks throw these away because they're too complicated. They're really not. It shows you how much you paid, when you paid it, and for what. And then it shows what your company paid out of your $4,100. Then on the last page, it'll give you a balance. I want everyone to remember that. Do not forget to read your statements. The other part is, if you are on a Medigap policy, you can purchase a prescription drug plan. It won't be included. You have to go out of your way to find one of those 62 companies out there, and you will be faced with a premium. The lower price plans, up to $50, $60 a month, will also carry a deductible from $0 to $445 per year. So you go down this road, you have to do a lot of homework. You have to go on Medicare.gov, put in the medications that you're on, and the governmental tool, we call it Medicare.gov, will give you the best plan to be on. You might not like the plan, but they're going to give it to you because they do the math for you. Or you could have our office, and we will do that as well as a free service. So therefore, on this type of plan, if you go into a Medigap policy, you got to purchase your drug plan. And like I said, from $7 all the way to over $200. The norm right now is between $20 and $30 a month. But I've had people pay $200 a month. I'm just warning you, make sure you know what you're doing on that one. Another program that we just talked about earlier when we first started is the Part D Senior Saver Program. I'll mention a few things. You might have seen scuttlebutt about it. In fact, there was a congressman on the television that last Saturday, and I saw he was the one who originated the program. And what he did is he went to the pharmaceutical companies and asked them to participate in a 5-year pilot program, and they were addressing the high cost of insulin. So the folks on insulin in 2021 will now be able to find a participating program that offers insulin at $35 a month or less, all the way down. And we already have one company here at St. Joseph's, one Medicare Advantage plan, that offers insulin at $0. I can't mention the name. You'd have to call up because we're not selling this plan right now. We're just educating you. Then the program is vast in scope. It offers a lot of different programs, but that's the feature. They're trying to lower insulin for the insulin dependent, for the diabetics. It's called Part D Senior Saver Model, and it is a pilot, and right now it looks like it goes for 5 years. In the prescription drug coverage, the next part we talk about it is that your prescription drug coverage initially gave you the $4,130 I told you about, and it will work all the way through till you use up your money. And those folks that are on a couple of generics and low-cost meds will never run out of money. It was designed to cover 80% of the population. However, those folks who are using expensive medications, and I happen to be one of them, I run out of my $4,130. My estimation is August. And then in August, I get notified through my statement, and it says by August 15th, when you purchase once again, then anything that's a tier 3 or 4, and I have 2 tier 3s, I will now have to pay 25%. Originally, the plan started me at $35. And then in August, I go to 25%. My medication happens to be a $519 drug. So I'm at $130 where I used to pay $35. That is called the donut hole. A lot of people have heard about the donut hole. The best way to explain it is the second phase of the coverage. The first phase was they give you the money. You go to the pharmacy and use it. If you use up your money, you're now in the coverage gap or the donut hole. And then they'll charge you 25% on the expensive drugs, tiers 3, 4, and sometimes 5. They track how much money you're going to pull out of your pocket in the calendar year. That will also be on your statement. And they're looking to see how they're going to give you the third phase, which is 5% coverage. They give you 95% coverage and you have to pay only 5%. Well, to get to that point, they track you at $6,550. If you pulled it out of your pocket and inform them a copay or a credit card charge to buy your meds, they're tracking the $6,550. If you've paid it, the rest of the year, you get 95% coverage. You only have to come up with a minimum of, or a maximum of 5%. And those are the three areas of coverage on Part D programs. So picking the right plan is essential for those folks, especially when they have a tier 3 or tier 4 drug. For those folks that think they might need extra help or qualify for extra help, the government, a federal program called Extra Help, you solicit this program through the Social Security office through a form, and if your income is low enough, we're talking about poverty levels, then extra help will be given to you. And what we just talked about earlier about the 4130, the 6500, and the 5% does not pertain to you. But you'd have to go to the Social Security office to see if you qualify. We pre-qualify people at the office all the time because they have never heard of this program. Now we're getting to the point where you've heard about Medicare Advantage plans with prescription drugs. You heard about Medigap policies, that's Medicare, original Medicare with a supplemental or a Medigap, okay? Then you have to add prescriptions if you're going to have that kind of policy. Those are your two avenues that you can have once you get your Medicare. So you have to educate yourself a little bit more, a little deeper, and compare which one is best for you. We do that almost every day. We have somebody call us that says, well, we need to find out where we should be. These are my circumstances. And then we address the medications and we come up with a plan. So in review, getting your original Medicare, it takes a little bit of doing. You have to know where to do it. Well, it's done through the Social Security office. And if you do it through the Social Security office, you can do it through the 1-800-772-1213 number and ask them, how do I apply? Another way to do it is contact them through the webpage at www.socialsecurity.gov and apply for Medicare A and B. For those of you that are over 65 and already have your A, be very careful. Just apply for the B so you won't mix the Social Security office up. Okay, so how you do this, the enrollment periods and timing is crucial. When would you do your application? Well, we always teach that if you're turning 65, you have 7 months, 3 months before your birth month, the month of your birth month, and 3 months after, giving you 7 months to kick it around, learn, go online, apply over the phone. It used to be you could walk into the Social Security office and apply, and I don't think they're doing that right now. So that's number one. You have 7 months, and once you decide that you need Medicare within those 7 months, you're going to get it. And then you would have to call a broker, an agent, to find out what am I going to get with my Medicare. So you do it simultaneously, and that's what we teach. Okay, so you got the 7 months down. It's called the Initial Coverage Election Period, the ICEP. The next election period I'll talk about is the Special Election Period. This is for folks that were still working or are still working and not retiring anytime soon. And they're going to go past their 65th birth month, and they're going to pass those 7 months, and then retire and solicit the Social Security office at a later date. What that means is they're not going to get 7 months to do it through a special election period. Actually, the Social Security office wants you to call them as soon as you decide, I'm retiring. And once you know in your heart of hearts and your mind, then you begin the process of applying for your Medicare B. Because after 65, your A has been sitting for you at the Social Security office all this time. The special election period is for those folks that plan to retire after they turn 65. They're still employed, and they will retire at a later date. And another acronym I'm going to mention right now is for those folks that are governed under the annual election period, or the AEP. The AEP is specific to those folks that are over 65 or have their Medicare already, and in the calendar year they get to October 15th. That starts the AEP, or the annual election period. Okay? It's very specific. It runs from October 15th through December 7th of every year. From the 7th to the end of from the 15th to the 7th, that's when you can select a Medicare program that has prescription drugs. You can get a standalone prescription drug program during this time, or change it if you already have one. Or you get a Medicare Advantage plan with prescription drugs, and you can shop it or keep it. But this is the time where you would sign paperwork to leave your plan and go on to a different plan. That's the annual election period. Very specific. Then Medicare closes down. The Social Security office closes down for new applicants. And what happens between the 7th of December and January 1 is that they move right into the OEP in January. They take a breather. They go through the holidays. And on January 1, until further notice, you get what's called the OEP. The open enrollment period goes from January 1st till March 31st. There are exceptions to these enrollments. This year was one of them. COVID let these plans talk to clients and have clients join them all the way through. I believe it went all the way through the end of April, if not June, May and June. So there's an extension because of COVID. There is an exception to what I just said. So if you are getting your Medicare A and B, Medicare will give you 6 months if you're going to go into a Medigap policy. So you have an extension of time. If you're using your original Medicare and you're going to wait around, shop around, they give you up to 6 months to change into or to add your Medigap policy. After that, you could join or you could solicit, you could apply for Medigap policies, but they don't have to take you because you have lost that guarantee. I have before me the star rating system that will allow you to know a little bit about it. So star rating system started about 10 years ago, and there are measurements that Medicare has on health plans that offer you plans with prescription drugs. They rate them 1 through 5, 5 being the best. And if you want to know how your plan is doing, you would ask your agent or your company to tell you what's your star rating. It's always in print, and it's given to you when you enroll, but sometimes you ask a question and they have to answer. Star rating systems have been around, and they'll continue to make these companies strive for 5 stars. The 5 stars is what Medicare is pushing these companies to be, because 5 is excellent. Right now, the companies I'm going to mention are involved with this program and have a contract with St. Joseph's, Providence St. Joseph's Mission, and St. Jude would be Blue Shield of California, SCAN, Clever Care, United Health Plan, Anthem, and HealthNet. Those are the 6 now contracted plans. We used to have 5 for about 7 years, and now we're going into 6. How you get information about these plans, you can contact me through our office. We have them at the office. We're getting deliveries every day right about now. and we are able to explain them and send them out to people so they can have them. And you can actually look at a glossy brochure to find out exactly what these plans are up to. We like to compare the plans side by side when somebody comes into the office to make sure you know how they differ. Okay. That concludes the program, and I hope that was helpful for you. There's a lot more to it, but in the last 20, 30 minutes, I hope that you got something out of this. Thank you.